A 64-year-old woman with a 20-year history of bipolar 1 disorder is brought to the hospital by her daughter due to increasingly erratic behavior. Over the past 2 weeks, she has been sleeping only 2 hours per night, making excessive purchases online, and has written emails to world leaders about her plans to restructure global diplomacy. In hospital, she is elated, euphoric, and speaks rapidly. She refuses all medications, stating, "I am just more enlightened than the rest of you. There's nothing wrong with me." The psychiatry team diagnoses her with acute mania and recommends treatment with a mood stabilizer and antipsychotics. When asked to consent to treatment, she refuses and insists on leaving the hospital. What is the most appropriate next step? Respect her autonomy and discharge her with outpatient follow-up. Seek a substitute decision maker to provide consent for treatment. C. Determine her capacity to make treatment decision before proceeding. D. Administer treatment without consent due to her psychiatric diagnosis. E. Apply for a guardianship order to manage her financial affairs. So here, the right answer for this question is C. Determine her capacity to make treatment decision before proceeding. Because this is an ideal case of capacity and confidentiality. So we have to figure out what is the best way to go for. And the reason why option A is not selected because respect her autonomy and discharge her without outpatient follow-up will not be safe. She is in clearly in manic episode. So we cannot do this because whenever someone does not have the capacity, we are not looking for their autonomy, we are looking for their safety first. Seek a substitute decision maker to provide consent for treatment. That is a good option, but not at the time because here we want to take a first step. First step is to evaluate patient's capacity. Although we know that patient's capacity is compromised here, but it has to be evaluated formally. Once we have formal assessment on her capacity, then we will go for a substitute decision maker. Administer treatment without consent due to her psychiatric diagnosis. That's not the right way to go for. We can do this whenever there is any emergency situation, but here without consent, without proper formal documentation, we cannot just administer it right away, although she is in mania. So we have to go for the steps. First step is to evaluate her capacity and make the formal diagnosis out of it, and then we can think about the other steps. Option E is apply for guardianship order to manage her financial affairs. So this is not the point here. This is not the emergency situation here to take care of financial affairs. Maybe this is something which we can do later, or we can offer patient and their family to think about it later, but it's not the time to think about this step.